The COVID-19 pandemic. At present, there is no cure, no drug, no vaccine, no silver bullet. Its impact has been profound. It stresses our frontline healthcare workers. It stresses our hospitals, particularly our intensive care units looking after the very sickest. And it stresses our communities, disproportionately affecting the elderly in long-term care and our marginalized homeless population. When a pandemic strikes, time is of the essence. And importantly, we need to mobilize our research capacity so that we can deal with the virus and its effect on patients and also address its profound impact on our communities. That's exactly what we're doing here at St. Michael's. Thanks to the Li Ka-shing Knowledge Institute and the Kina Research Center for Biomedical Science, we are applying our bench-to-bedside translational research capacity to generate new knowledge with a view to improving patient care. At the same time, our expertise in addressing inequities in the community positions us to lessen the impact of the pandemic on marginalized populations in our city. Importantly, we strive to have global impact. What we learn now, the lessons of our research, will be disseminated elsewhere in the world to help not only this pandemic, but those in the future. The government is providing emergency research funding for a number of projects. In fact, St. Michael's received 10% of the first round allocated across the country. But many more of our top scientists are at the starting gate. Bottom line, funding for research is scarce. And if ever there was a time to invest in high potential science, it's now. In response to the COVID pandemic, our scientists have pivoted their research and focused exclusively on issues related to the pandemic. This might seem like a protean task, but in fact, the proposals of our researchers already aligns well with the strength of their research. We are recognized as a world-class center for the care of the critically ill patient, and in particular, those with lung inflammation. We are at home to the world's top 2 experts in mechanical ventilation, whose research has already fundamentally transformed clinical practice. Where better than here at St. Michael's should novel approaches to ventilating critically ill COVID patients be performed? We are already doing this in the Caviards trial funded by our federal government. We couple this with another one of our strengths, namely understanding the biology and lung inflammation in another one of our studies, where we're learning about how the virus affects the immune system by using patient samples and applying this knowledge to treatment of ventilated patients. This bench-to-bedside approach is one of our hallmarks and highlights the value of having clinicians doing research that address critical questions in patients. Finally, our work with marginalized populations through the MAP group is globally renowned for its excellence and its impact. Income disparities have potential to impact tremendously on marginalized populations. Our research will help to better understand how these impact on physical distancing, mental stress, and reintegration after the pandemic subsides. St. Michael's Hospital Foundation launched the Power Fund to ensure projects like these receive the funding they need to tackle this pandemic head-on. As the Vice President of Research and Innovation at St. Michael's Hospital, I can't tell you how meaningful your gifts will be to our scientists. They are working day in and day out right now to ensure that we have a safer and healthier future, and I have never felt more optimistic about what they will achieve. So please join us, support St. Michael's Power Fund, and let's end COVID-19.